growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi, everyone. Welcome back to the Lionhearted Dental Podcast with Dr. Steve Rasner. So here we are in mid-July, and I want to tell you something. The title of this week's podcast, and please don't turn it off when I say this, is called The Danger of Doing Nothing. Staying status quo. And you know, when I do these podcasts for you, I do think about them before I start. And I think about what will help you usually on Monday morning. And this one may not do that. This one may lead to other things that help you on some Monday mornings that are upcoming in your future. And it's critically important that you think about what I'm about to say to you. So, first, thanks to everybody that continues to download these podcasts, which are thousands of you per month. Little housekeeping. I don't do this often, and you know it. But it's unusual that in September 24th and 5th, I think it's a Friday and Saturday, my next atraumatic extraction course, which is where, you learn. You can come from any state in the United States. I prep you for 90 minutes each day with basic skill sets, and then you work live on patients in a team with one other doctor. It's limited to 8 doctors. Plus observers. And it's practice changing for you. It's career changing. Because you can learn, even in 2 days, enough of a foundation to go back and do these things immediately. So it's pretty good. Of course, most of my courses are usually sold out by this point. So there's 2 spots, and I'm talking to you in mid-July. So any of you that have been thinking about, geez, he keeps talking, because I always tell you that the quickest line for where you're at to a fee-for-service practice is 4 steps. It is getting an oral sedation permit. It is learning atraumatic extractions, grafting, and some level of surgical implant dentistry. Yeah, that's my road. Getting an oral sedation permit, because it changes everything, as we'll talk about a little bit in this podcast. Atraumatic extractions, taking teeth out. How to graft, because that wasn't a thing 40 years ago. But it's very much a thing today. And then, at some point, acquiring implant surgical skills. So yeah, there is a course that I give, and you don't take mine, take somebody's. If there's a place you can learn live. Once you learn surgery, implants, grafting, taking teeth out, I know I make fun of it. I don't make fun of it. I allude to it. You actually can go on YouTube and improve the level that you're at and get better by watching videos of many, many talented clinicians out there. Nobody gives a live hands-on. That's not you watching me. I have an agreement with the state of New Jersey, which is really hard to get, to have you do the surgeries. So for 2 days you're allowed to do that in my state if you have a license in your state. I wish it extended to all my global friends around the planet, but as we speak, it doesn't. So that's my housekeeping. Let's go back to the danger of doing nothing. And why would I choose that subject? Because here's why. And I think those of you that know me or may get to know me, I think it's a fair thing for me to say that you would think I'm a rock solid, emotional kind of guy. I don't crumble easy. Good or bad, it's just the way I am. But telling you what I'm about to tell you almost makes me emotional And that is, I sit here 40 years into this. Remember, the title, The Danger of Doing Nothing. And I simply cannot account for where the time went. And I know we all talk about that all the time. Oh my God, this year went so fast, or the last couple years went so fast. But you chose a challenging career of dentistry. And it's very easy to fall into a pattern of unfulfillment that you'll end up regretting because you just did. Nobody pushed you. I mean, who's pushing you? Who really knows what you do every day besides you? Your team doesn't even know. Your front desk team doesn't even know what you really do back in the clinic. They schedule it. They get payments for it. But they don't know about the patient that wants to throw up, that's got a big gag reflex. You can't put a patient in a supine position because of whatever. Or the fear the patient has of the noise and the gripping, or they can't get numb. And you've gotten 350 consecutive patients numb with that infiltration procedure that you've used for years. But for whatever reason, by the way, that just happened to me, this patient won't get numb on this day. And it makes for a hard day. Yes. Your front desk team doesn't really even know. Your wife or husband, I doubt, know. Only you. And so it's a little bit of a lonely road. I want to point something out to you. I was doing a presentation in Florida about 2 years ago. No, Dallas. And I did some research on internal medicine physicians. And the statistics of the study done on internal medicine physicians is that 20% of them would not choose the same specialty. A third of them wouldn't even choose a medical career if they had it to do over again. And when they asked them why, they cited things like they have to see 2 patients every hour. They spend 24% of their time on paperwork, and they work an average of 54 hours a week. And 20% of them have seen a decrease in pay over the last 5 years. That's physicians. So it's a real thing if you're not fulfilled. And it's easy. It is. It is easy to justify, what else am I going to do? I have so much money in this. Oh my God, I'll disappoint so many people. And I'm not here today to tell you to get out of dentistry. For goodness sakes, I'm not telling you that. I have been, to a fault, a cheerleader for many of you of how great this profession can be. And I've always told you that even when it's great for me, it is also still challenging. By the way, just on that infiltration thing. So I had a patient come in. I just want you to know that I live in your world and how I manage it. And I had a patient come in for a simple endodontic procedure, detected the need in a recall. Good guy. I done significant full coverage crown and bridge on him in the anterior. I don't remember any issues with it, and he needed endo on number 7. And he comes in, I didn't even think about it. I mean, it's a gift, right? Got to make an access through the lingual of the crown, zirconia crown, no problem. Every time I touched him, he jumped through the ceiling. So I anesthetize him again, jumps through the ceiling. I mean, I find that very unusual because I can take a hot tooth out with articaine, 4% articaine, almost under any conditions. And I couldn't even touch the tooth. And yet, when I asked him about it, he said it hurt. He wasn't like, obviously I wouldn't have scheduled it. I would have given him a round of antibiotics if I thought it was a hot tooth. So I rescheduled him. And I did do that. They gave him a round of antibiotics. I waited 10 days. I questioned him if the tooth bothered him at all before we confirmed the appointment. And he said, it's better. He sat in my chair. This is the second appointment. He jumps again. I mean, I'm not even doing anything. I'm barely touching the tooth. I give him every shot that I teach other dentists to give. And I am frustrated. You've heard me act like this before. I'm almost angry. Like, I can't believe this is happening. But he's a good guy, and he's invested a lot of money in me. And I insisted. I didn't want to say it's in your head, but I thought it was in his head. So I insisted if he wanted me to complete it or start it. I didn't even reach the nerve. I touched the lingual of the tooth. But when I tapped on the tooth before without a drill, he didn't act the same way. It's only when I had the drill in my hand. So I insisted that he gets sedated for this, in the oral sedation you always hear me talk about. And I did it on Thursday in 25 minutes perfectly. Not a thing. Which is why you need to listen to my oral sedation recommendations. It really makes your life better. But anyway, I got off the track. I just wanted to tell you that I experience stuff too. So what I'm about to say, I realize, is going to impact you different right now. If you're a D student in dental school, D3-4, if you're a young associate, if you're opening up a practice, what I'm about to impact you on the danger of doing nothing, or if you're an experienced clinician. You may react differently depending on where you're at in your career. And the first thing I have to ask you to ask yourself, because listen what I'm doing. I'm asking you not to allow 5 years to pass and waste it because you could have changed it for the better. Because of what I said to you earlier, I've had a pretty damn great career. And yet I don't know where the 40 years went. It is so scary. I can't explain it to you. It is. It's like, think about it if you're me. Most of my colleagues are retiring. A lot of my colleagues have children working with them. And I'm in there not much different mentally than I was 30 years ago about my career. And I almost feel guilty about it sometimes. Like, what's wrong with me? Why shouldn't I be winding it down? And I know there's lots of you like me that still like what you do. You know, look, I don't want to get off the track because this is about you catching yourself right now at the first sign that you may be complacent or too comfortable and not happy. That's what I mean. So are you happy? Here's how you figure this out. You need to take some time next weekend or this weekend if you're watching this on a weekend. Nobody around, and ask yourself, are you happy with your career? You got to ask the sacrilegious question. And if you're not, is it dentistry? Man, if it was me and it was dentistry and I would always try. I mean, we put 8 years into this minimal. College, undergrad, grad, probably a lot more. I would always try to see if I could find a part of dentistry that would make me happier. You know, I know a lot of dentists that just thrive in public service dentistry. Civil service. They work in the military. They work for different agencies. And they like that. They love that. That would not be for me a little bit. I'm appreciative of the colleagues of ours that do that because it's so altruistic to me. But are you happy? And if you're not happy, why? Now this is important. What I'm about to say to you is important because you have to write all these down and say, are you overworked? Is it too many hours? That should be an easy answer for most of you. I'll give you another one that's huge that I don't think many of you think about. This is huge. Do you like where you live? If you're happy as a clam, then cut out this podcast and wait till next week. But I'm really, really doing this for a reason. I so much care about so many of you that I get to connect with. And I think I represent many of us in how I think. And, I went through a whole career. I don't love where I live. And it went too long, so I couldn't change it. I could have, but I didn't want to. But that's an important part. If you don't like where you live and you get one chance at that, that's why I would think it's great to have an associateship early on. I don't know if I've ever said this to you before, but if I was regraduating, I would do exactly what I did 40 years ago. I worked multiple associateships on purpose, including one with my father that was in the town I grew up with that had degraded as a nice place to live. It was a great place to live growing up. But in the time that I left to go to college, dental school, it had changed dramatically. And I really didn't want to be there, but I didn't have any other options, which is also another story. At that point in my career, I didn't feel like I had any other options. So, long story short, flash forward to today, I travel 50 minutes each way because my practice is so kicker and killing, bad words, but fun, and what I want, that there's no way I'm giving it up and trying to rebuild this ship. So I live in Philadelphia and I'm willing to travel. And if you're that kind of person, that's a solution. You'll love this one. I'm asking you a couple things here. I'm asking you the danger of doing nothing. In other words, status quo, not changing the way things are and feeling miserable. And how do you know you feel miserable? It starts around Saturday night, sometimes Sunday morning. I've been there. And the thought of going in on Monday is not exciting. And it can be for all the reasons I'm telling you right now. And this one is, do you hate some of your staff? Maybe you bought a practice and you prudently kept most of them in the beginning. Now the beginning has turned into a couple years now, and you might be scared to get rid of that hygienist or front desk person that has nothing in common with your philosophy of how you want patients treated. Nothing. So here's my response to that one. That one's an easy one to me. You have to grow some guts. There's a lot of ways for me to have said that, by the way. You have to get some guts and realize that if you have a staff member that can change your physiology, meaning your heart rate, meaning anxiety, just by seeing them again on Monday, they haven't even said anything to you, then you need to really think about ending that relationship, or certainly addressing it and giving it one more chance, or the first chance. I would get rid of it. Seriously, you think I'm joking, but I know you. Some of you know what I'm talking about. I lived it. And that was one of the many sources of what I didn't like when I drove to work on Monday morning. Here's a giant one. Do you feel like you're not fulfilling your potential? Like you're just doing stuff each day, which we're going to get to in a minute. It does nothing for you. You don't even like the stuff you do. And I know this is a big thing for associate dentist. And it's different if it's a big thing for associate dentist versus one of those of you that have been fortunate to buy and start your own practice, because you have more control over what you get to do each day. But often the associate is designated to do fillings and, other things that the associate owner that hired you doesn't want to do anymore. And that's the price. That's what you get to earn by being the owner. And we've all been there. So is that what's wrong? Do you know that's part of it? That you'd go to work each day and nothing excites you. You're going to do fillings all day. Maybe you'll get lucky and you'll do one crown. That we can absolutely address in this next episode, because these are going to be connected. I hope you don't turn this off, because, man, you get one chance with all this. I'm dead serious. I know some of you will remember this podcast years from now. And I know people tell you this, like your parents tell you this. Time goes quick. Enjoy the roses. And they're all correct about those things. That's indeed something you should do. But nobody knows what you're dealing with as a dentist every day. Just you. And you know this is true. Like I started this podcast with. They know that you have a hard day or a great day, but they don't always know exactly what's going on back there. And if your average day is doing a number of restorations on 10 different patients, no wonder you don't like dentistry. No wonder you're burned out. Or if you have no control over the level and quality of your dental assistant, or the type of equipment and material supplies you get to use, like you want to be using A supplies, but the place you've been hired at never uses those kind of things, and half the equipment's broken, and once in a while you get lucky and you get to one of the 3 hand pieces that actually work, and the Alabama cabinets are missing all kinds of things, so you got to move them bodily. You feel me? You understand that I know what I'm talking about? Well, or does an upcoming day ever get you excited? Like, I have my printout for the next 2 weeks right next to me right now. And yeah, I mean, that's why these principles over and over each week that I beat to death are so critical, because that's the outcome. The alternative is the things I'm alluding to. Too many hours. Everything I've talked about in the last 2 years. Having a staff that doesn't measure up. And some of you are in associateship. So what are you going to do? You're going to have to challenge and deal with the owner. That's a change. You have got to say to yourself to listen to your gut after you ask these questions. If you're doing things each day or each year that you don't like pediatric dentistry, and it may change for you over the years. You may like it in the beginning and then not like it. Or full denture cases. Not implant-related denture cases. Denture cases. Or just fillings. No wonder many of you would feel unfulfilled. I certainly would, looking back. So you need to find out, and you need to make changes. That's the guts of this podcast. I took a risk doing this today, because I'm not giving you something, which I'll do next week, that you can literally take back on Monday and implement, but maybe this will kickstart one of you. And if I lost 20 viewers because what's he talking about, then it was worth the one I reached. Because it's going to go too fast, and it's too good of a potential career for you to sit idle and become lethargic, complacent. I make good money, decent money, I put a lot into it. Obviously I'm a person that's all about dentistry in my career. I get it. I'm a little over the top. Maybe a lot over the top. But that's what you need. You need the voice of me in your ear, especially if you want to be a Lionhearted dentist, which is a dentist who has the ability, if he wants to be, to have a fee-for-service independent practice, or builds that kind of culture within another practice as an associate. And the only way you get that is have the guts to go and talk to the owner. And if you have to switch jobs, then you switch jobs. Because nobody's going to give you back this year. And that's the takeaway. The takeaway is for you, before we go in to the next podcast next week, to be more specific about a couple things, including why is case acceptance so challenging for you to present for so many of us. And I absolutely know why. And I've talked about it before, but we're going to talk about it again. But for this week, it's time, man. Those of you that have been in practice, maybe you're on the verge of burnout. It's happened to me. Whether it's burnout or you're an associate and everything I just said resonates to you too loudly, I have your answer. I hope you were patient with me in listening to this week. And stay strong, because the Lionhearted path, is the path you should be on. See you next week.